class. So we are now in our lesson 5 and our topic for today is liver function test. So please refer to your handouts for our discussion. So first, for our learning objectives, first, you must identify tests necessary in evaluating liver function. Second, determine the importance of liver function tests in the diagnosis of hepatobiliary disorders. Third, interpret normal or abnormal results based on different methods used in liver function evaluation. So first, for our introduction, liver function tests, also called hepatic panel, are blood tests used to monitor liver function and damage. These tests provide insights into several aspects of liver health, notably the liver's ability to synthesize enzymes and proteins, the liver's ability to process bilirubin and secrete bile, and the extent of liver damage. Abnormal liver function test results do not always indicate liver damage. Some abnormalities are transient or they may result from different non-hepatic causes. So first, we will be discussing about the biochemical functions of the liver. So as you can see, there are a lot of functions of the liver. It has functions as a storage, it has functions in metabolism, synthetic function, detoxification function, and excretory and secretory function. So first, for the storage, it is the storage site of all fat-soluble and water-soluble vitamins. It is also the storage depot of glycogen. For the metabolism, it is the metabolic site of the carbohydrates, the major player in maintaining stable glucose concentration, which performs glycogenesis, glycogenolysis, and gluconeogenesis. It also performs in the metabolism of fat and the major site of metabolic clearance of many other hormones. So, for its synthetic activity, one of the major synthetic activity of the liver is the production of plasma proteins. So it synthesizes albumin and most of the alpha and beta globulin except the immunoglobulins, which is synthesized by the B lymphocytes. All the blood clotting factors, and it also synthesizes positive and negative acute phase reactants and coagulation proteins. It also synthesizes enzymes which were found useful in the diagnosis of hepatobiliary disorders. So these enzymes include AST, ALT, ALP, 5-NT, and GGT. So i-discuss natin mamaya isa-isa itong mga enzymes na ito. So for the detoxification function, so mainly sa detoxification function ng ating liver, ang ating tinetest ay ang ammonia. So it serves to protect the body from potentially injurious substances absorbed from the intestinal tract and toxic byproducts of metabolism. So since ammonia is a toxic byproduct, it is converted to urea in the liver. Next, for the excretory and secretory function of our liver. So mainly it is in the excretion of bile acids or salts, pigments, and cholesterol, and major excretion and secretory function is the excretion of bilirubin in the body. So for the assessment of liver, there are different tests for the assessment of liver function. For the test for excretory and secretory function, ang hinahanap natin dito or ang tinetest po natin dito ay ang bilirubin, urobilinogen, and bile acid. So we will be discussing it later for the bilirubin determination and the urobilinogen and bile acid determination. So next, for the test for detoxification function, ang hinahanap natin ditong test ay liver enzymes and ammonia. So usually, ang bang mga liver enzymes na nabanggit natin kanina, the AST, ALT, 5-NT, and GGT. For the test measuring naman hepatic synthetic ability, under this test, it includes total proteins, albumin, gamma globulin, PTA, and PTT. So since, as what I have mentioned earlier, the major synthetic activity of the liver is to produce these plasma proteins. So other tests includes autoimmune markers as well. So now, for the bilirubin determination under the excretory and secretory assessment for liver function. So it detects serum bilirubin. It uses spectrophotometry. So in spectrophotometry, it uses Van der Berg reaction as this diazotization. So under this Van der Berg reaction, there are two methods, the Evelyn-Malloy and the Jendrassik and Grof. It also uses enzymatic method, which uses bilirubin oxidase for each reaction. So bilirubin is also can be seen in the urine. So ano bang hinahanap natin dito? So we will be discussing about the Ehrlich's diazo reaction and ICTO test later. Icterus index also is under the bilirubin determination and direct spectrophotometry. So now, as you can see here in the picture, there is a the bilirubin metabolism. So I will be discussing a quick or fast track for bilirubin metabolism. So now, please refer to your handouts, okay? Para ma-follow nyo po ako sa ating discussion. So we are in the prehepatic phase muna. So for the prehepatic phase, so now we begin with the red blood cells. Nagsimula tayo sa red blood cells. So these red blood cells will explode after 120 days. So you must remember that red blood cells or the normal red blood cells circulates around the body for about 120 days. So after 120 days, these red blood cells will now be degraded by the macrophages, releasing hemoglobin molecule. So ano ba ang purpose basically ng ating red blood cells? It circulates around the body and carries oxygen around. So ano bang molecule or component ng red blood cells ang nagke-carry ng oxygen around the body? Yun po ay ang hemoglobin. So upon degradation of this RBC releasing its hemoglobin molecules, this hemoglobin will be further degraded into heme and globin. So tandaan nyo, after the breakdown of RBC, it will release hemoglobin. Hemoglobin will be further degraded into heme and globin. So globin now is an essential amino acid. So it will re-enter the blood for erythropoiesis or for the formation of red blood cells. Now, heme is a porphyrin ring. It is broken down further into iron. So iron will re-enter the blood for erythropoiesis. It is also essential for the production of red blood cells. And now this heme or this porphyrin ring will be converted into bilirubin or unconjugated bilirubin by the bilirubin reductase. Now for this biliverdin will be converted into the liver. So since this unconjugated bilirubin, tandaan po natin, this unconjugated bilirubin is lipid soluble. So upon the travel of this unconjugated bilirubin in the liver, hindi siya makaka-travel sa ating liver because it is lipid soluble. So ano ba ang kailangan natin? So it needs a transport protein, which is albumin, for it to be transported in the liver. So now we are in the hepatic phase of bilirubin metabolism. So now in the liver, this unconjugated bilirubin will be conjugated by the addition of glucuronic acid by UDP glucuronil transferase. So this unconjugated bilirubin now water soluble. So this now in the liver, what happens is the conjugation process. Okay. So next, we are in the post-hepatic phase of bilirubin metabolism. So in the post-hepatic phase, this new conjugated bilirubin is now water-soluble. Since siya ay na-conjugate na sa liver, siya ay water-soluble na. So now we can excrete this water-soluble bilirubin into the liver in bile. So this bile, which contains conjugated bilirubin and bile salts and other stuff, will eventually be excreted to the small intestine by the common bile duct. So when the conjugated bilirubin is in the small intestine, so itong conjugated bilirubin nandito na sa ating small intestine, it will travel along to the large intestine. So meron ditong section sa ating large intestine called ileum. So in this section, the conjugated bilirubin will be converted by the intestinal bacteria, specifically Enterobacteriaceae, into urobilinogen by removing the glucuronic acid by hydrolysis. So upon the removal of glucuronic acid, it is once again lipid soluble. So since sa kanina in-explain ko na ang ating unconjugated bilirubin will be water soluble when in the addition of glucuronic acid. So now in the intestine, ang ating conjugated bilirubin, inaalisan na natin ng glucuronic acid. That's why babalik siya sa pagiging lipid soluble. So, ano ba ang nangyayari sa ating urobilinogen? So, 85 to 95% is oxidized by bacteria forming stercobilin, which is the brown pigment in the feces. So that's what happened to most of the bilirubin. It is excreted out in feces. So ano bang mangyayari sa 10 to 15% na urobilinogen that is reabsorbed in the body? So the small percentage will be carried by the albumin back to liver through the portal system. About 5% will participate in enterohepatic urobilinogen cycle, in which it is taken up by the liver and is resecreted into the bile again. So the remaining 5% of urobilinogen is transported by the blood to the kidneys, where it is converted to urobilin and is secreted, giving urine its yellow color. Okay, remember, ang most of the urobilinogen is excreted in the body. 85 to 90% is excreted in the body, forming stercobilin, which gives brown color in the feces. And then the small percentage will be reabsorbed by the body and will be reprocessed and will now be excreted in the urine, which gives its yellow color, the urobilin. Okay? Naiintindihan po ba ang ating fast track sa ating bilirubin metabolism? Okay. So now, for the bilirubin determination. For the specimen requirements tayo. So for the methods na tayo for liver function evaluation. Ano ba ang kailangan? Serum ba? Plasma ba? Fasting ba? Ano bang kailangan natin? So, fasting serum specimen is recommended. The presence of lipemia will increase the measured bilirubin concentration. So, as I have mentioned earlier, ang ginagamit natin for testing is spectrophotometer. So, for the spectrophotometer, cloudy specimen or milky specimen caused by plasma proteins or increased levels of triglycerides can cause increase in bilirubin. So, nagkakaroon tayo ng alteration sa ating results. Hemolyzed specimen is not recommended. So, non-hemolyzed specimen because hemolysis causes false low result. So, sample must be protected from direct exposure to light because bilirubin is photosensitive and breaks down upon exposure to light. Ito ang number 1 na pakatatandaan po natin that during the collection of bilirubin, kailangan po nating ma-protect ang ating specimen from light. So usually in the clinical setting, wala naman tayong masyado nito na ganitong amber bottle or amber microtainer. So what we will do is to wrap, Wala tayo. So what we will do is to wrap the specimen or the test tube. We use a carbon paper to protect the specimen from exposure from light kapag ka meron tayong bilirubin request from the doctor. Okay? Tandaan, during bilirubin determination, kailangan ay ma-cover natin ang ating specimen or the specimen container with anything, ito, nakalagay dito in foil wrapping or in clinical setting, we use carbon paper. So now, we will be discussing about the Evelyn-Malloy method in the bilirubin assay. So, in Evelyn-Malloy method, we uses van der Berg reaction. We uses diazo reagent. So, ano ba ang component ng diazo reagent? For the diazo 1A, it is composed of 0.1% sulfonilic acid plus hydrochloric acid. For the diazo B, it is composed of 0.5% sodium nitrite. So bilirubin and the diazo reagent form an azobilirubin complex which can be measured colorimetry at 560 nanometer. So the direct bilirubin or the conjugated bilirubin is water soluble. Okay, tandaan po natin the direct bilirubin or the B2 is water soluble, and therefore it will react with the diazo reagent in a water solution. So for the unconjugated bilirubin naman, hindi siya water soluble, it is lipid soluble. Therefore, alcohol is necessary to put the conjugated bilirubin in solution so that it can react in the diazo reaction. So in here, for the direct bilirubin, serum plus diazo reagent will form azobilirubin. Ang color niya ay purple. For the total bilirubin, dinadagdagan po natin ang serum ng methanol to form azobilirubin, pink to purple color. So the solubilizer or the coupling accelerator, remember, ay methanol. For the indirect bilirubin, nakukompute po at nakukuha ang ating indirect bilirubin by subtracting total bilirubin from direct bilirubin. Okay, remember, the coupling accelerator in Evelyn-Malloy method is methanol, and the pH here is acidic. In Evelyn-Malloy method, pH is acidic, the coupling accelerator is methanol. For the Jędrusik and Grof method, it also uses van der Berg reaction. The buffer used is sodium acetate. The ascorbic acid is used to stop the reaction. So alkaline tartrate is administered, or it uses to make the solution alkaline. So it is read at 600 nanometers. Direct bilirubin is detected from adding the serum plus diazo reagent plus ascorbic acid to stop the reaction plus the alkaline tartrate. The end product is blue. Total bilirubin, serum is added plus the diazo reagent plus caffeine benzoate plus ascorbic acid and alkaline tartrate to make the solution alkaline. End product is blue. Coupling accelerator is caffeine benzoate. So it is preferred over methanol because methanol promotes protein precipitation and increases turbidity. So same with the Evelyn-Malloy, indirect bilirubin is obtained from total bilirubin subtracted to direct bilirubin. So guys, remember, for the Evelyn-Malloy, it has a pH of acidic. It has an acidic pH. It uses methanol as coupling accelerator. For the Jędrusik Grof, it uses caffeine benzoate as its coupling accelerator. It has an alkaline pH. Okay, remember that. So for, again, in bilirubin determination, it also uses its enzymatic method. So in enzymatic method, pH 8.0 or in alkaline pH, total bilirubin is detected. Conjugated and conjugated or delta bilirubin will be converted to biliverdin by bilirubin oxidase. So in detection of direct bilirubin, pH po natin is acidic, 4.5. Conjugated bilirubin is converted to biliverdin by bilirubin oxidase. Decrease in absorbance at 460 nanometer. For our icterus index. So in icterus index, a measure of the degree of icterus ang ginagawa po natin dito sa ating plasma or serum in cases of jaundice due to hemobilirubin and cholebilirubin. So for its test, it involves diluting the serum with saline or NSS or sodium citrate solution until it visually matches the color of 0.01 potassium dichromate standard solution. So the number of times the serum must be diluted is called icterus index. Units used is the absorbance of specimen divided by the absorbance of standard times 10. The reference value of icterus index is 3 to 8 icterus index. Sources of error include substances in the serum other than bilirubin such as carotene, xanthophylls, and hemoglobin may contribute to the icterus index, limiting its usefulness. Thus, this test is now obsolete. So, meaning this test is no longer used dahil napakarami niyang interferences. Dahil marami tayong components sa blood na nakaka-affect sa testing. So, for the direct spectrophotometry, it is not practical for adult but has value in evaluation of jaundice in newborns. So it is only valid for newborn whose serum does not contain lipochromes. The absorbance of hemoglobin at 455 nanometer is corrected by subtracting the absorbance at 575 nanometer. So for the specimen requirements in direct spectrophotometry, serum is collected and stored with the same precautions for adult specimen. Specimen can also be obtained through skin puncture technique since newborn can have difficulties in blood collection through venipuncture. So since specimen can also be obtained through skin puncture, this method is relatively insensitive to hemolysis, which is often present in specimens obtained from infants due to difficulty in skin puncture technique. So, compared to the determination of bilirubin in adults, we do not recommend hemolyzed specimen because hindi naman mahirap magkuha ng or mag-obtain ng blood sa adults, not unlike sa ating babies. So kaya in direct spectrophotometry, hemolysis is, in this method, hemolysis is insensitive. Okay? Kasi ang mga specimen natin ay obtained from patients. So usually, mahirap naman talaga kuhanin ng patient. So most of the time, magkakaroon tayo ng hemolyzed specimen. So here are the reference values for bilirubin in adults and infants. So there are different reference ranges from premature infants to full-term infants and also to adults. So remember the conversion factor for bilirubin is 17.1. Excuse me. For the urobilinogen, so urobilinogen is seen in urine and feces. So kung natatandaan nyo, ang ating fast track sa ating bilirubin metabolism, so urobilinogen can be seen in urine and feces. So sa urine, ano ba ang nako-convert ang urobilinogen? To urobilin. And sa feces, nako-convert ang urobilinogen to stercobilin. So, increased urinary urobilinogen ay makikita sa hemolytic disease or defective liver cell function. So, in hemolytic disease kasi, the lifespan of the RBC is shorter compared to the lifespan of a normal RBC, which is 120 days. So decreased fecal urobilinogen, sa decreased fecal urobilinogen, it is a nakikita ito sa biliary obstruction. So usually, kapag meron tayong decreased fecal urobilinogen, makikita natin sa ating stool or sa ating pupu ay pale color siya. Wala siyang brown color. Medyo maputi-puti siya. So ang ibig sabihin nun, there is most likely na merong biliary obstruction. Okay? So, Ehrlich's reagent. For the Ehrlich's test, baka tatandaan ang gumagamit ng PDAB or the p-dimethyl aminobenzaldehyde ay urobilinogen. Ehrlich's test for urobilinogen. So, for the urine urobilinogen, ang ginagamit po natin dito ay fresh 2 or urine sample which should be kept cool and protected from light. So, urobilinogen in the urine plus the addition of Ehrlich's reagent, which is the PDAB, will form a red color under spectrophotometer. The reference value is 0.1 to 1 Ehrlich unit every 2 hours, 0.5 to 4.0 Ehrlich units per day. For the fecal urobilinogen, it is a semi-quantitative determination. So it uses aqueous extract of fresh feces. So urobilin will be converted to urobilinogen by alkaline ferrous hydroxide with the addition of Ehrlich's reagent forming red color. Reference range is 75 to 275 Ehrlich's unit per 100 grams of fresh feces and 75 to 400 Ehrlich's units per 24-hour specimen. Okay. For the serum bile acids, serum bile acids is a complex method and required for the analysis of bile acids in serum is the extraction with organic solvents, partition chromatography, gas chromatography, mass spectroscopy, spectrophotometry, ultraviolet light absorption, fluorescence, radioimmunoassay, and enzyme immunoassay. So for the specimen here, postprandial serum sample allows a more sensitive distinction between normal and abnormal values than testing a fasting sample because the usual increase in secretion is stimulated by eating. So, in serum bile acids, hindi po fasting ang ating specimen dito. Usually, ang ginagamit po ay postprandial serum sample. So, increase in serum bile acid is liver disease. Ratio of trihydroxy to dihydroxy bile acids in serum differentiates patients with obstructive jaundice from those with hepatocellular jaundice. So the ratio of the cholic and cyanidiocyclic acid in serum aids in the diagnosis of primary biliary cirrhosis and extrahepatic cholestasis. So high ratio is biliary obstruction. Kapag naman po low ratio, primary biliary cirrhosis. So now, we are in the liver enzymes. So liver enzymes differentiate hepatocellular from obstructive diseases. First, the AST and ALT. So no, first, for the specimen pala muna. Specimen, serum is the specimen of choice for most of the liver enzyme tests. Blood is usually collected together with other tests that uses serum as its sample. So, most of the time, sinasabay na ito sa mga other laboratory tests, such as yung mga may fasting sample. Okay? For the AST and ALT or the aminotransferases, it is increased in damaged or necrotic hepatocytes and high concentration drug hepatotoxicity. So, as I have encountered before, usually AST and ALT are increased in those patients na maraming medications. So, usually, ayan, nakalagay high concentration kasi nagkakaroon na sila ng drug hepatotoxicity, kaya nag-i-increase ang AST and ALT. So, since detoxification function ng ating liver, nag-i-increase ang AST and ALT kasi too much na ang kailangan niyang i-detoxify. Okay? Next is to ALP or the phosphatase. It is increase in extrahepatic biliary obstruction. Or it is used most often in clinical diagnosis of bone and liver disease. It is the most striking elevation is up to 20 times, which occurs in the extrahepatic biliary obstruction. Next is the 5-NT or the 5-nucleotidase. It differentiates ALP elevations. So used clinically to determine whether ALP elevation is caused by liver or bone disease. So 5-NT differentiates ALP elevations. Kapag mataas ang ALP at mataas ang 5-NT, liver disease. Pag mataas ang ALP but normal to slightly elevated naman ang 5-NT, bone disease. Okay, remember that, class. Next is the GGT. It also differentiates ALP elevations. It also used to detect chronic alcohol and drug ingestion. So it is elevated in the serum of almost all patients with hepatobiliary disorders. Highest level are seen in biliary obstruction and chronic alcohol and drug ingestion. So GGT level returns to normal after 3 to 6 weeks of absentation from alcohol, making it a useful test for compliance in alcohol reduction programs. So itong GGT, usual test to in detecting sa mga alcoholic patients or chronic alcohol drinkers, okay? For the LD, or the lactate dehydrogenase, the LD 4 and 5 isoenzymes are seen in skeletal muscle and liver. So it is also seen in acute hepatitis or cirrhosis. So increase in LD is seen in acute hepatitis and cirrhosis. Okay, finally, in our detoxification function, the test for ammonia. So increase in ammonia is seen in hepatic coma and advanced liver disease. It is also used for the diagnosis of hepatic failure and Reye's syndrome. Liver converts ammonia to urea. So ano ba yung urea na test natin sa ating laboratory? So usually, ang test dito ay yung ating BUN. So nakikita rin dito sa ating BUN ang ability ng ating liver to detoxify. Pag increase ang ating urea, ibig sabihin, maraming dinodetoxify or kino-convert ang ating liver na ammonia. Okay? For the pre-analytical or the specimen requirements for ammonia, maraming considerations din ito katulad sa bilirubin. So hemolyzed specimen should not be used. Plasma, heparin or EDTA kept on ice as much as possible in order to minimize the formation of ammonia. Specimen should be removed promptly from the contact with red cells and must be analyzed ASAP. So usually naman sa lahat ng ating specimen, ang dapat separate natin agad ang serum sa ating red blood cells because it may alter results kapag napatagal pa ang contact ng ating plasma sa ating red blood cells. Refrigerated if not performed immediately, freeze if delayed beyond 24 hours. So avoid using cleaning solution or hand cream na nagko-contain ng ammonia. It will alter also the result. It will falsely increase the result of ammonia. Avoid tourniquet, fist clenching. So, ano bang specimen collection ang ina-avoidan ng paggamit ng tourniquet? So, we will use arterial blood. So, arterial is preferred. Arterial blood collection is preferred. So, avoid exercise or any strenuous activity and smoking prior to testing. So, in ammonia, it uses Berthelot reaction. Ammonia plus phenol plus hypochlorite will form indophenol blue. So in its enzymatic assay, it uses glutamate dehydrogenase, and it is read in the decrease in absorbance at 340 nanometers. So ammonia plus alpha ketoglutaric acid plus NADH will be converted into glutamic acid by glutamate dehydrogenase. Reference value for ammonia, please refer to the picture. Okay, class? Next is the test measuring hepatic synthetic activity. So the major synthetic activity again of the liver is to synthesize plasma proteins. TPAG, or the total protein albumin and globulin ratio, is decreased in cirrhosis. Ay, mabalik pala tayo, class. For the ammonia, sources of error, tandaan natin, glucose levels over 600 mgdl decreases the ammonia result by 8 to 40 micromole per liter. Tandaan po natin, kapag masyadong diabetic ang ating pasyente, tapos kukuha natin siya ng ammonia test, possible na magkaroon ng decreased ammonia result. High BUN levels values as well may increase values of ammonia by 14 micromole per liter. Okay. Balik po tayo sa ating test measuring hepatic synthetic activity. So it includes TPAG, albumin, AG ratio, PT-PTT, gamma globulins. So in gamma globulins, IgG and IgM are increased in chronic hepatitis. IgM is increased in biliary cirrhosis, and IgA is increased in alcoholic cirrhosis. Okay, tapos na po tayo sa assessment of liver function and other. Now we are in our autoimmune markers in liver function test. So for the anti-mitochondrial antibody, it is used to detect the primary biliary cirrhosis. The method used is ELISA. So the AMA with anti-M2 specificity is 100% specific for PBC, or the primary biliary cirrhosis. Next is the anti-neutrophil cytoplasmic antibodies, or ANCA. It is used in detecting primary sclerosing cholangitis. It is an autoimmune disease associated with the destruction of extrahepatic and intrahepatic bile ducts. Next is anti-nuclear antibody and anti-smooth muscle antibody. So in here, greater than 1:80 ang titer niya, meaning type 1 autoimmune hepatitis po ang ating diagnosis. So in the antibodies to liver, kidney, microsomal antigens, type 2 at autoimmune hepatitis. So other tests includes hepatitis profile and MELD score. So for the MELD score, or for the model for end-stage renal disease, so ang dinadetect po natin dito ay, ang kinukuhang test ay bilirubin, PT, and serum creatinine. So the probability of survival of patients with liver disease, ginagamit po natin ito. So the TIPS, or the transjugular intrahepatic post-systematic shunt, kapag ka ang ating MELD score ay greater than 24, TIPS is not recommended. Okay? For the PGA index, or the PT is prolonged, the GGT is elevated, or the ApoA1 is increased in alcoholic liver hepatitis or liver injury, and decrease in cirrhosis. For the A1 antitrypsin ceruloplasmin, it is in the excretory function of the liver. Ceruloplasmin is removed by the liver. So since it is under the excretory function of the liver, ang ating ceruloplasmin ay nire-remove ng liver. So increase in ceruloplasmin has an impact in the, or damage in the excretory function of the liver. AAT is a hereditary deficiency which is associated with early cirrhosis. Vitamin K response test. Okay, supplement use is vitamin K. The normal second test is vitamin K deficiency. For the hypuric acid synthesis, it assesses the detoxification function of the liver. Normal liver benzoate is detoxified into hypuric acid. Normal result, hypuric acid is in the urine. Okay, end of presentation. Okay, guys, remember again sa ating bilirubin. Bilirubin 2, or the conjugated bilirubin, is water soluble. Unconjugated bilirubin, indirect bilirubin, or B1, is lipid soluble. Okay? handaan. And thank you for listening to our discussion.